Okay. All right. Hafa welcome everyone, and thank you for joining us today. Today we celebrate a very special occasion. It is to present a resolution number 76-36LS, sponsored by myself, Therese Terlaje, and the rest of the senators. And this is relative to recognizing May 2021 as Asthma and Allergy Awareness Month, and to commending the Guam Asthma and Allergy Support Program, also known as GAASP, and healthcare professionals who treat asthma and allergy-related health conditions for promoting education, spreading awareness on its prevalence, and advancing care. So the resolution, I'm going to read this, and with me today, I have members of GAASP. I'm so honored that you are here, and thank you for taking the time. And later, I'm going to have Linda introduce all of you, okay? And all right, so resolution number 76-36LS begins with, be it resolved by Emina 36 na legislature in Guam, whereas May 2021 is recognized as Asthma and Allergy Awareness Month for the purposes of educating the community about asthma and allergy-related health conditions and advancing care. Asthma is a disease that affects the lungs and is one of the most common long-term diseases in children. Attacks happen in the body's airways, which swell and shrink, allowing less air in and out of the lungs and creating mucus that clogs up the airway and causes wheezing, breathlessness, chest tightness, and coughing. In the United States, 1 in 13, or 25 million people, have asthma and allergies, with increasing numbers each year. Asthma accounted for 1.7 million emergency department visits. On average, 10 individuals die from asthma per day. Please join us. Our Legislative Secretary, Senator Amanda Shelton, could I have her stand right here, is also here to join us today. Thank you, Senator. According to the 2019 Behavioral Risk Factor Surveillance System, a survey revealed that 5,556 individuals in Guam have asthma. An allergy occurs when the body's immune system sees a certain substance as harmful and may inflame the skin, sinuses, airways, or digestive system. Reactions can range from minor irritation to anaphylaxis, a potentially life-threatening emergency. More than 50 million Americans suffer from different types of allergies, such as allergies to food, pollen, and drugs. There's no cure for asthma and allergies, but these diseases are manageable. Death is preventable with proper treatment and care. However, those with severe asthma and allergies may be at greater risk of developing serious complications because of COVID-19. The Guam Asthma and Allergy Support Program's mission is to improve the health and well-being of people with asthma and allergies through education, advocacy, networking, and activities. Some of its current projects include data collection from hospitals and clinics to research how many individuals on island have asthma and allergies, to file as a nonprofit organization, to recruit members and volunteers, to hold monthly support meetings with medical advisors, and attend health fairs or expositions. This May, GAASP, in partnership with the Allergy and Asthma Network, is launching the first nationwide Asthma Awareness Month Virtual Fitness Challenge, a month-long initiative encouraging people to get active and live healthier. As research has shown, regular exercise is linked to improved asthma control and quality of life. Now, therefore, be it resolved that Emina 36 na legislature in Guam does hereby, on behalf of the people of Guam, recognize May 2021 as Asthma and Allergy Awareness Month, and commends Guam Asthma and Allergy Support Program, GAASP, and healthcare professionals who treat asthma and allergy-related health conditions for promoting education, spreading awareness on its prevalence, and advancing care. And be it further resolved that the Speaker certify and the Legislative Secretary attest to the adoption hereof and that copies of the same be thereafter transmitted to Guam's Asthma and Allergy Support Program, GAASP, and to the Honorable Lourdes A. Leon Guerrero y Magahagan, Guam. Duly and regularly adopted by Emini 36 na legislature in Guam, signed by Speaker Therese M. Terlaje and the Legislative Secretary, Amanda Shelton. And this is our resolution, which we will present to the President, Linda. And I'd like to ask Linda to please, if you could, just introduce the group that you have with us and tell us a little bit if you'd like.
Okay. Hafa day and good evening. First of all, I'd like to thank the Honorable Therese Terlaje and her staff for introducing this resolution, as well as Honorable Amanda Shelton for being here, having her presence. I also like to thank our GAASP members, and I'd like to introduce them. From my left, I have Shirley Trinidad, our member, Minda Guerrero, member. To my right, I have Esther Elena, member also and treasurer for the last couple years. And I'd like to thank Dodea employees. We have Alicia Lim, our nurse from Dodea Guam High School, as well as Sterling Sotomil. She's the nurse for McCool Elementary Middle School. I also like to thank our medical advisor who could not be here today. His name is Dr. Michael Augustine from GRMC, as well as Dr. Nakunj Bhatt, who was our medical advisor at the beginning, who also will provide virtual lectures and presentations for GAASP. I also like to thank our recording secretary, Mila Ramos, and a member, Therese Regis, who could not be here. And to all the people who could not be here today due to their asthma and allergies and other comorbidities, and to all our asthma patients, clients, family, and friends who are joining us live via Facebook or YouTube. Thank you to each and every one of you for taking the time out of your busy schedules to be a part of this resolution. The last few years has been very challenging for our organization. I'm profoundly proud to serve as chairperson and work side by side with our board members. These women and men that I serve made a positive impact on promoting asthma and allergies. Thank you, board members. Special thanks to, of course, John F. Kennedy High School's Junior Achievement, who, for their leadership, support, and successfully raising funds to donate to our organization for selling masquerade masks. A little bit about our history. Well, we started back in August 2016 with a very few members, but we were officially recognized via a proclamation on May 2017. Our mission is to improve the health and well-being of people with asthma and allergies through education, advocacy, networking, and activities. Our organization is affiliated with Asthma and Allergy Foundation of America, known as AFA, and we are now joining membership with Asthma and Allergy Network, AAN. We are celebrating May as Asthma and Awareness Month to, one, wear something gray or a gray ribbon. We are also getting active for a good cause. Allergy and Asthma Network is conducting a virtual fitness challenge. It's only 15 minutes a day. We kicked off since May 1st with a walk-run at your own pace, followed by a 1-month virtual workout plan provided you pay the registration fee of $20. It's an online exercise program as part of a whole body approach to your lung health. You get exercise, you boost your immune system and support. Don't forget to hashtag Asthma Challenge and challenge your friends and family. And don't forget, it's important. If you have asthma, allergies, or other lying health conditions, please talk to your doctor before engaging in any physical activity. We are also actively trying to recruit more officers, members, and volunteers. Create a calendar to hold virtual monthly meetings with medical advisors to talk about asthma and allergies. We want to coordinate, compile, and collect data from hospitals and clinics to research how many on island have asthma and/or allergies. We exist today because of personal reasons and my views, but my views is just my personal views, but I want to talk about why it's so important to me. I want to let you know that I grew up with asthma since I was a child. I believe maybe I was a newborn. And I almost passed away a couple times. But the one thing that lingers on were two visits that I remember going to the hospital. One when I was 4 years old. I was taken to the old GMH. I hope some of you remember the old GMH. Maybe some of you were not born, but I know I was born at that time when the old GMH was right next to Hilton. Well, I remember it so clear because I was in a bubble, clear plastic container. And all I could see was visitors through that, and I could not hear them talk. Being, 4 or 5, I couldn't hear anything because I was fully covered with a plastic container. It's a clear plastic, and they gave me I was souped up with IV oxygen, and it really had an impact on me. Then on another separate occasion, I was about 8 years old and on my way to FHP clinic in Tamuning. And my doctor at that time was Dr. Statler, the late Dr. Statler. Bless his heart, I wish he was here today. Yes, I know. And I wish that I could thank him. All I can hear him say was a lot of angry words. He was very upset at my mom because of the way I was breathing and gasping, because my life almost ended that day. And it was really sad. It's hard to believe that I survived that day. You see, as much as I know some of the internal matters why I was like that was because of not having maybe enough oxygen or medication in me. My asthma is very severe, and every time I had my attacks, can you imagine the vaccination I was given? I didn't know what it was called at that time, but it was such a powerful vaccine that I threw up every 30 minutes it was given to me. And I felt like I was high on cocaine or some drug, and it made me stay awake for hours. I took that so often through my whole life that I feel part of that medication has already done some damage inside me, in my organs. But as I grew older in my 20s, I grew out of it at one time, but it came back later in the 20s. Some people are so fortunate to outgrow this disease, but some people have it come back, and I'm one of that. I also remember another family from my ex-boyfriend at the time told me about one of his cousin's son passing away from asthma. I was shocked and taken back to hear a child at such a young age just pass away. Then I also have another aunt who passed away from Mahina from asthma several years ago. I wonder how many lives have been affected on Guam due to asthma and allergies. My personal stories and experiences makes me why I wanted to start GAASP, but I am just one out of the hundreds children or adults who have it, and their stories are just the same or worse as mine. Due to the current pandemic, COVID-19, we want to know how many lives it has taken with those who had underlying conditions with asthma or allergies or comorbidities. Data such as how many men or women on Guam have these. What are their ages? Do they smoke? Do they not smoke? Because we have unfinished business to support and advocate for those who suffer from asthma, from this deadly disease. It is not a contagious disease, but for those who have it It is a life-threatening disease that can take our life at any given moment. Also, if we do not take our rescue medications, such as our inhalers, which is the albuterol or Combivent, our life is at stake. Can you imagine the lifestyle we live if medicines were not available to us? Think about it. Is there any organic or herb medicine that would heal us today? Probably not. We also need volunteers to collect, and I repeated this over, compile data that is measured in order for us to conclude certain facts. We need volunteers to assist with this research. I've emailed hospitals and clinics, and I hope you're hearing me out there if you can help me get these stats that I need. We also think that a lot of people in Guam who suffer from this disease, and it is sad that they do not want to come out and expose themselves or let others know that they have it. Maybe they are ashamed, maybe they're embarrassed to let their friends know that they have asthma or allergies, or could it be a sign of privacy? Well, we do respect the Access to Information and Protection of Privacy Act, also known as APA. But we want the public to know that you can attend our meetings without your privacy being respected and protected. But in order to help you, we need to hear from you, and we will protect your identity 100%. Someday, wouldn't it be nice to know that we can end the suffering for those who have asthma or allergies? They say there is no cure, but we can find ways to prevent it from coming back, right? In closing, our work will never end until we find a cure. If you would like to donate to this worthwhile cause, please contact our treasurer, Esther. For those of you who would like to volunteer or make a change, please contact myself or any of the board members at 788-3856 or GAASPorganization@gmail.com. Thank you, Sidus Maasi, and have a nice evening.
Thank you very much, Linda. Thank you. And thanks again to all of you who are here with us today. And I wanted to just read that figure one more time. It's 5,556 individuals in Guam are known to have asthma. And as Linda described, we think there may be more out there that are just not reported, or with allergies especially not reported. And that I do agree that compilation of the data is very important. We've seen this with many of our illnesses, that if we can compile the right data, we can get additional resources, we can get additional help. And so I commend you and your group, GAASP, for taking that on as their mission and for the hard work that you're putting in to get that accomplished. I'd like to ask of the Legislative Secretary, Senator Amanda Shelton, would like to say a few words.
Thank you very much, Madam Speaker, and thank you to GAASP for being here today. And Linda, thank you so much for sharing your story. I can hear the passion in your voice for wanting to advocate for yourself and many others in our community. And as the speaker said, the data, the research is so important so that we can work together to find solutions and to bring awareness to asthma and allergies. And so I want to thank you very much for all of the advocacy that you will continue to do. And it's organizations like this, community organizations, volunteers who really push us to do better, to find the solutions, to work together so that we can have a better and healthier community and prevent incidents of death from asthma or allergies. And so until we find a cure, we will continue to raise awareness and support as best we can to ensure that we don't have that kind of suffering in our community. So I thank you all again, and Seduas Masi.
Yes. Again, thank you all for those who are here and those who are watching. I'm pretty sure that those who are watching must know, if not in their own immediate family, but know of other family members who have been impacted by asthma and allergies severely, and that has restricted their lifestyles in some cases. And so, again, I thank this group GAASP for the awareness that they bring this month and throughout the year, and for all the hard work. And Situs Maasi, and again, congratulations on Situs Maasi. That will end.